Local, state, and federal officials are urging calm today as the number of cases of COVID-19 coronavirus rise around the globe and in the U.S. Today, the World Health Organization said the virus has reached 64 countries, including the U.S. One person in the U.S. has died. Tia Collins says efforts are underway now to plan for a potential emergency here at home. Tia?
That's right, Maureen. A potential emergency. There are still no cases confirmed of the COVID-19 or coronavirus here in New York State, but leaders say they need to get ready for a potential outbreak in order to have a good response and limit the impact on the local economy. At the Monroe County Office of Emergency Management, County Executive Adam Bello, Congressman Joe Morelli, and the County Health Director had a message when it comes to the COVID-19 or coronavirus outbreak.
It's critical we take precautionary actions to prepare to make sure that if and when the risk becomes greater, that we're prepared to respond to it.
Morelli is pushing for funding from the federal government of up to $8 billion to handle this new health emergency.
The money will be used to, as I said, assist state and local governments, hopefully accelerating vaccination studies, making certain that we aid small businesses.
The concerns that we would be looking at is if there was an outbreak, all the costs associated with quarantining people, the economic loss of not being able to go to work, daycare costs, the cost of feeding people and providing the services that we as a county government are going to need to provide folks.
Bello said that the county is coordinating its efforts with local hospitals, schools, colleges, and businesses. The risk of a coronavirus outbreak is still low, according to the County Department of Health, although leaders say area hospitals are well prepared for the worst-case scenarios.
We've been in constant communication with the hospitals. They have plans in place, and they will activate them as necessary.
Saying the risk of getting the virus is low, but symptoms do include fever and any lower respiratory issues similar to those of the flu. In the event someone should need to be tested, New York has become one of the first states approved to do testing for the coronavirus in state labs.